Hello and welcome to Let's Talk About, a health podcast series brought to you by Tallaght University Hospital in partnership with the Adelaide Health Foundation. This is our second six-part podcast series, which you can find on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode in the series will be targeted at anyone who wants to learn more about their brain, how they can mind it and how they can keep it healthy. Weighing in at approximately 3 pounds or 1.3 kilograms, the brain is a complex organ that is made up of soft tissue called grey matter and white matter, which contain neurons. Neurons are cells that send and receive information throughout our bodies in the form of electrical and chemical signals. Think of your brain as mission control for how you move, your senses, thought and reasoning, memory and vital functions such as your heart rate and breathing. Like everything else, your brain ages, but as you will learn in this series, there are lots of steps we can all take to help maintain a strong and healthy brain. The most important thing to remember is, it is never too early or too late to look after your brain health. Hello, my name is Paul McElwain and I am a consultant geriatrician at TUH and your podcast host. In this Let's Talk About podcast episode, we're going to talk about the importance of movement for brain health. I'm delighted to be joined by Evelyn Kimmage, Physiotherapist, and Professor Seán Kennelly, Consultant Geriatrician. Hello.
Hello, Paul.
Hello, Paul.
So let's talk about the brain and the importance of brain health. And can we start with you, Evelyn, with a very basic question, but one I know is important. What is the difference between physical activity and exercise?
So the main difference between physical activity and exercise is that physical activity is something that we don't really think about. It's built into our daily routine. So beyond sitting in a chair, physical activity is something like getting out of bed, walking up and down the stairs, even something as simple as washing the dishes. So it's just our everyday movement. Exercise is a more purposeful activity that we plan into our routine. So that might be something like planning to go for a run, planning to go for a swim, and it's a more purposeful activity. Something that we don't really think about.
Okay. So what type of exercise is best and how does it exert these effects?
Yeah, so when we look at brain health, then the best type of exercise would really be aerobic exercise, because that kind of exercise really works our heart and our lungs and gets things moving. And the main thing is it improves our blood flow throughout our body, and then improved blood flow to the brain can help regenerate brain cells, which is really beneficial when we think of brain health. There are other forms of exercise such as resistance training and flexibility exercises such as yoga. They all have benefits as well, but in terms of our brain health, the best kind of exercise is aerobic exercise.
So, is there a difference in the stage of life we do exercise? In other words, mid versus later life?
The difference in the stage of life is in midlife, there's probably more benefits in terms of exercise for our brain health. In that, if we're very active in midlife, it can prevent things like high blood pressure, stroke, risk of cardiovascular disease and type 2 diabetes. And these are all risk factors when it comes to developing a dementia. In later life, there are very much benefits to exercise in that it has been shown in some research that it can kind of slow down the development of a dementia, but this is all emerging evidence.
Okay, so if I ask you, Seán, we might go into your area of expertise. Can you tell us if physical activity has an effect on our risk of having memory problems or dementia?
Yeah, so I think a good place to step back and actually start is with the whole concept of brain health. 5 years ago, we wouldn't be having this conversation because we didn't have the evidence base that suggested that we could prevent dementia. And that's where this whole concept of brain health has come from. When we look at factors that can contribute to the risk of developing dementia, and we look at things that we can do to intervene and reduce that risk. When we look at things like stopping smoking, reducing our alcohol intake, better diet, better control of our blood pressure. Consistently throughout all of those studies that measure the impact of those interventions, better exercise and more exercise comes out on top as the most potent indicator. And we just by exercising alone and doing more exercising alone, it looks like we can reduce our risk of developing dementia by 30 to 40%. If exercise was a tablet, I always say we'd be taking 2 or 3 of them a day and we wouldn't think twice about it, but it does, demand some motivation from us. It does demand a plan. It does demand coordination, and it does demand community services to support people who want to exercise more, who may not know how to start at it. But the evidence very much supports us, as Evelyn was mentioning, that actually we can see parts of the brain that we know shrink with dementia enlarge with exercise, and that enlarges. So the equivalent of 1 year's worth of exercising counteracts the equivalent of 2 years shrinkage that we might see with dementia. So there's very, very objective measures that we have that show that exercise is a very potent impact on reducing a risk of developing dementia and changes to our brain.
Okay. And does that that physical exercise benefit extend to people who are currently living with dementia?
Yeah, so the advice is we should exercise for as long as possible. We know that there's probably more evidence from the point of view of, if we look at the scientific research for people at midlife, and when we look at what we call our population studies, where we just look at the general population and see what are the factors, we've got more evidence because there's more population studies that look at younger people of the impact of exercising, let's say in our 50s and 60s, at reducing a risk than, let's say, the impact of exercise in our 70s and 80s. But we have an increasing evidence base that when we're older, there's a benefit. But also we now have an increasing evidence base that when we're living with dementia, there's a benefit. Because there's a benefit on things not necessarily related to memory issues, but related to what we call responsive behaviours. We know people who continue exercising are less likely to be depressed, they're less likely to get agitated with their dementia, and they're less likely to have other consequences. And also falls is a big consequence associated with a decline in performance for somebody who's living with dementia. And we know that more exercising, and in particular, you might be changing the type of exercise. So you might be switching from, let's say, an aerobic exercise to something that's more like a balance-based exercise piece to reduce people's risk of falling, in which case, that really makes an impact on the trajectory of their decline with dementia. So yeah, there's certainly an evidence base to support ensuring that people with dementia continue exercising for as long as possible.
Okay. And I suppose one of the things that can be quite challenging is actually getting access to exercise and maybe the motivation to do it. I don't know, let's start with you, perhaps, Evelyn. Have you any sort of suggestions for people listening on how they can engage with more physical activity, number one, but physical exercise specifically?
Yeah, absolutely. So in terms of our local areas, the easiest way to access exercise would be through your local health centre, having an assessment by a physiotherapist. But also there's much more informal ways of accessing exercise. So nationally, there's a programme called XWell, which offers exercise groups for all ages from middle age upwards. And then that would be a more structured form of exercise. But then outside of that, you could have even something as simple as going out for a walk with your dog. And that's something that the Tilda data would point very strongly to, that going for a walk with a dog can be really beneficial in that it promotes social engagement. It's a purposeful activity. It's something you're likely to do on a daily basis. And it really promotes that well-being piece as well as the exercise piece.
I don't know if you have something to add on that, Seán.
I think, as Evelyn mentioned, there is the ability to compound the benefit in that if you're exercising while also having social engagement, well, we know that those are two key factors that can really improve your brain health. So there's things you can do as part of exercising, and even dancing. So if you take that while you're aerobically exercising while you're dancing, you're also improving balance, and you're often, if you're dancing with a partner, you've also got that added enhanced cognitive stimulation benefit that you can get when you're doing. So even beyond the simple exercise, there is added benefits in how you do it and how you access it. And structured programs like XWell are a really good intro for somebody who maybe hasn't exercised in a while. I think it's really important, coming back to that earlier point on the difference between physical activity and exercising. Most of our evidence is around exercise. And that's the importance of trying to do something that's different to what we do day to day. Because I have lots of people who kind of come in and say they're very active, but if you're not having that dedicated period whereby you're doing something that's focused, you don't get the same benefits as you do if you're just going around it. But it is to make it as accessible as possible.
Yeah, and I think one of the learnings from the pandemic really was that when people were at home on their own, it was quite difficult, especially for older people, to get out and exercise. But now things have really opened up again. A lot of our community services are coming back into play. And here in Tala University Hospital, we have our Charlie O'Toole unit where we run exercise groups for our older people. And it's a really good way of getting people to complete strength and balance training in a group. And we know that really having the peer support of other people can help with that motivation piece. So accessing through our local health centres and in through the Charlie O'Toole unit is a really good way of accessing those services.
Seán, I don't know if you have anything to add on that.
Yeah, I was going to say, I mean, I suppose our geriatrician's creed is, we're born as copies and die as originals. And there's this broad spectrum of older people who have different levels of ability. So there are people who might be a little bit frailer who would come into our Charlie O'Toole unit, but there is also very healthy and well older adults in the community who need to be supported and linked in with community services. And we have a community partner, Exwell, that we would also refer people to who do that type of engagement and support that type of engagement. But also the local sports partnerships have an awful lot of access programs for people who want to engage in kind of structured and support piece for doing their exercising. I think a really important piece that we started here as well is we have a brain health clinic. And as part of that brain health clinic, we go through in detail all of these other factors that are associated, as we'll cover across the podcast series, that are associated with brain health. In exercising, we are specifically able to measure the amount of exercise that somebody's doing and, if you like, prescribe it. And the whole role of social prescribers in trying to actually signpost people towards local community services who are doing this piece is really important. So people do need a delivery platform. The era whereby you gave a leaflet and told people go off and do more exercise should be gone. And it's now about giving really practical suggestions and supports and specific directions as to how people can engage around their exercising.
So I think it would be ideal, it's just what we often do near the end of the podcast, is to come up with maybe some top tips or some key takeaway points for our listeners. I'll start with you, Evelyn.
Yeah, absolutely. And I think when it comes to exercise, if it's something that you're going to fit into your routine, it would be really important that you pick something that you enjoy, and that maybe it can be something that you could do with a friend or a family member to get that emotional support. In terms of guidelines, the recommendation is that we would try and fit in about 30 minutes of exercise on most days of the week. And again, that it be something that you really get enjoyment out of.
Okay. And Seán?
So a regular question I'm asked in clinic when I'm prescribing exercising is, well, how do I know it's enough? And the answer is the same as the cardiologist would often say: you should be able to talk but not sing. So it's of a sufficient intensity that you shouldn't be overly pushing yourself, or you should be building up to that threshold. Of course, get some advice if you're worried about your health and whether or not it's advisable for you to immediately start exercising. But for most people, even with significant heart risk or lung risk, or exercising has a profoundly positive benefit. I think exactly what Evelyn said. I think really important, try and get an exercise buddy. We know that there's better compliance and a likelihood to stay the distance where you have an exercise buddy or you're doing it in a partnership.
Okay, well, thank you very much. So thank you so much to our contributors, Evelyn and Seán, this week. I think the key takeaway point is exercise is something you should enjoy, and it certainly has massive health benefits, particularly for your brain health. So thank you for listening. In the next episode, we will look at the role of assisted technology and how that can play an important role with people who have dementia.